Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K. Thank you, everybody, for joining us. As today, we discuss hormones, or more specifically, testosterone. And we're going to talk about who should be on it, why you need it, how it works, how to dose it. And just as a prelude, we will be splitting this into two parts where we have testosterone and then everything else. Let's get into it.
Let's go. So before we dive in, I just want to say, having a care team and working with different people with different perspectives usually can lend the best outcome to your health.
Well, I think that's true for most things. I tell people all the time, I'm just a piece of your puzzle. All the things we're doing in my office, it may help you 100%. Good chance it won't. And you probably have to go do some other things on your own with some other people.
Yeah.
That's just how it goes.
Yeah. And that's actually a very good sign of how good a practitioner is. If a practitioner is telling you that they can solve everything for you, they're probably not a great practitioner because they need to know their limits, they need to know their scope, and they need to have a network of other practitioners and people in the health realm that can help you in different ways that they can. So let's go ahead and dive on into testosterone. So, I want to start with the women because it's so often overlooked that women need testosterone too. And I believe that testosterone by volume is the actual highest level of a hormone that women have in their bodies. They actually have more testosterone than estrogen.
Really?
Yep. So it is so necessary for both males and females to have testosterone. And overall, whether you're male or female, what this molecule really does is a lot of things, but kind of the main thing is drive. Your will to do things, your will to wake up and go to your job, get things done, your will to advance in your career, take really good care of your family, go work out, whatever it might be. It's the molecule of drive or will or wanting to do things, kind of associated with dopamine. It's the hormone. I would say it's kind of the hormone version of that drive neurochemical of dopamine. Is that a good read on that, Dr. K?
Yeah, pretty much. Hormones one of the key regulatory hormones in the body. So if you're low in it, a lot of things stop working. But to touch on your point, so you say it's really high in women. Does that mean the ranges for women should be higher than that for men? Should women's testosterone be like 2,000?
No. So even though it's one of the most abundant hormones in a woman's body, the ranges are still much lower than what men need to be optimal. So in terms of optimal ranges, you're looking at total testosterone. Men, probably optimal. Your lab work will tell you that the range is somewhere around 250 to 700, 800, or 900 is probably, depending on your lab, is where the range is. Optimal is a different range. So once you get out of traditional lab work and traditional medicine and move to optimization, you kind of want to be, for men, you want to be around north of 500 or 600 for sure. And then usually I've seen people need to cap out around 12 or 1300 at the very max, but it's very individual. So most people feel optimal at 7 or 8, and that's myself. 800, 900 is kind of where I like to cap out, or else I get too much aromatization, so it changes to estrogen. And then some people just feel optimal at higher, 12, 1300, depending on who they are and their needs.
So I want to pause right there and bring up a point. And I think we've mentioned this in previous episodes, but I think it's worth noting again. So you said optimal versus, normal range. And so that 275, if it's not optimal, where is it coming from? So what people have to realize is normal is not necessarily what's good. It's just what is average in America for Americans. And so this is a well-known fact in most people that deal with hormones. The average testosterone levels have been significantly decreasing over the last 100 years in America. And so what Quest and LabCorp do, and that's why their ranges slightly differ. They're pretty much the same, but what they do is every 10 or so years, they take an average pool, and this doesn't just apply to testosterone, it applies to all blood work, but they take an average of what they see. And so if everyone is sitting between 300 and 500, that's just what they're going to consider normal. Regardless of the fact that you want to be over 500, as long as that's what everyone is, that's okay.
Yeah. So the scary part of this is someone can come on in at like a 290 and be considered not deficient in testosterone, even if they have all of the symptoms of hypogonadism.
Yeah, and honestly, the second part is they don't take age into account for testosterone. An 18-year-old and an 80-year-old should not have the same testosterone counts. But when you go to Quest, they don't take that into consideration. Everyone is 275 to 800.
Yeah, that's a big point. Although the biohackers might disagree with you there, because I know plenty of old people that want the testosterone level of an 18-year-old.
I mean, sure, that'd be nice, but it's not expected.
No, it's not expected. Yeah. So the range, basically, the normal lab range is around 250 to 800-ish. It changes a little bit based on the lab, but optimal is north of 500. Probably, I would say optimal 6 to 1200 is where I would put the optimal range for men. And then for women, the lab work, I forget where the top of the lab work is, but I think it stops around 50, and the bottom's around 8. So 8 to 50 on total testosterone. And then optimal is actually between 60 and... So the optimal range is completely outside of the normal range of testosterone for women. So again, it's just like you said, it's the average. So testosterone has been dropping not only for men, but for women. It's for everybody across the board has been dropping. And the average for women has actually dropped significantly. So what we're seeing is women can come in with a free testosterone of 9, 8, still be in range, the bottom of the range, but still be there. And they're not considered deficient, when really this is crushingly low. And along with this comes all kinds of other random health things that pop up. Like I've seen people who, when they supplement with testosterone, their lipids fix themselves. And so does their glucose control. Just like that. Only lifestyle change.
Let's bring up a point is, do we know why testosterone has been dropping in America?
Well, I don't want to get canceled in this podcast, but talking about this is a sketchy topic. But I mean, it really comes down to toxins. It's all the toxins in our environment, and you're looking at everything from self-care products, xenoestrogens, plant toxins. You're looking at chemicals. A lot of the chemicals that we use in our everyday life and farming and pesticides and all that stuff operate as estrogen in the body, except 1,000 times, up to 1,000 times more powerful than estrogen. And then you've got things like mold. There's a mold they put it in the ear of cows and they get fat on 30% less calories. And that one is basically how it works, is it's a super potent estrogen mimicker. And so it is everywhere. Personal care products, pesticides, our food, our clothes, even in our water. There's estrogen in our water. There's been all kinds of studies showing estrogen in our water. Some of it's due to, small amounts due to like birth control not being effectively filtered out of our water system in our water treatment plants. And then all kinds of downstream, the biggest one is the downstream effects from industrial processing or farming, from all these pesticides that are just making it into our water. And our water filtration systems and our city water treatment plants are not set up to filter pharmaceutical waste. So it just gets right through.
So I think that's the other part of it is dairy. The amount of growth hormones in the dairy industry is ridiculous. And a lot of those growth hormones promote estrogen production. And if you look, there's dairy in literally everything now. Things that have no business having dairy have dairy. Mm-hmm. And I think that's the second aspect to it, is we're all getting flooded with growth hormones.
Yeah, that's very important. And this is why, making sure that you live a clean lifestyle and slowing your flow of toxins is very important. So, I mean, something like dairy, this can be avoided by using local, organic, raw milk, that type of stuff. And you can avoid all those hormones. This is a shameless plug for my coaching company, Toxic Roots. If you think you might have toxins that are affecting your hormones, call us up and we can go through an initial consultation and we can talk. And if you need some hormones and stuff like that, we can talk to Dr. K and we'll help you out there. So I mentioned what it does, and I mostly said drive, but it does a lot of other things. The main one people think of sex drive, which I categorize under drive. So your libido, it controls your libido. It's a thermostat on it. So if it's low, you're going to have a very low libido. And if it's high, you're going to be more like a youthful kid in terms of libido. Think of someone in their teens, or how you felt when you were going through puberty. So that's another thing. And then it actually also has a massive effect on your muscle creation, gain, retention, and your fat levels also as a downstream effect. So those are the main effects of testosterone. Anything I'm missing, Dr. K?
That pretty much sums up. There's a bunch of secondary effects of testosterone, but we don't want to just overcomplicate this topic.
Yeah. The last thing I will say on this is it's very potent for mental health. If you are low in testosterone, like I remember the optimal range is about 600 to 1200. I was 159 when I got my first testosterone test. So extremely low, clinically low on all lab work anyway. It was just low. And I had all kinds of like depression, anxiety, and things like that. And when I started supplementing and fixing it, supporting my testosterone, that went away just like in a couple days. So mental health issues gone.
To give you guys an idea, so Kyle in college was an elite level rower.
Mm-hmm.
And so he was performing at that level even with low testosterone, most likely.
Yeah. Yes. Yeah.
So just because you can perform at an elite level doesn't mean your testosterone isn't low. It's probably still worth getting checked out because there's a chance that, if you need it elevated and you get it elevated, you could perform so much better than you already are.
Yeah. And thanks for saying I was performing at elite level. I appreciate that. That might be a bit of a stretch, but hey, I'll take it. Yeah. So no, but that's huge. Actually, what a lot of people don't realize is all the training that goes into collegiate sports and high intensity sports like that often actually lowers your testosterone even further. So you could still be performing well or decently, but maybe have some mental health issues or have just low energy in the afternoons and that kind of stuff. And it could be your testosterone. So we kind of talked about what it does, why we need it, males and females. We talked about ranges. You want to move into how to increase it, or is there anything else you could hit?
No, let's talk about how to treat it.
How to treat it. Okay. Well, number one, out the gate, diet and lifestyle. This is huge. And I know everybody says this and most people don't want to hear it. And most people want the quick, easy fix. But the thing is, testosterone responds extremely well to diet and lifestyle. So if you clean up your diet, you eat whole natural foods, increase your protein to a gram per pound of body weight, start strength training in an appropriate manner, most likely your testosterone will increase. I've worked with people and it's not uncommon for people to double their testosterone from 200 or 300 to 6 just with diet and lifestyle alone. A lot of times what we're eating and how we're living is just not conducive to healthy hormones. And if we change those things, we can radically improve our testosterone.
Yeah.
Any points there for me, Dr. K?
No, that's a really big aspect is even before you get into supplementation and, getting on testosterone injections, try and fix it yourself naturally as much as you can. Because, eventually most people that are on testosterone end up hating the injections after a while. Because it kind of sucks. You have to poke yourself twice a week with two different things.
Yeah. So actually, it's a good point. It reminds me the other third pillar of a good lifestyle to increase your testosterone is sleep. Most of your testosterone production is regulated during your sleep. So if you're not getting that deep sleep in the first half of the night, your testosterone levels will be lower. So if you fix your eating, whole natural foods, strength train 2 to 3 times a week, appropriate for your situation, and maximize your sleep, and we'll probably have an episode on sleep and how to maximize it later, that will dramatically increase your testosterone. Like Dr. K said, well before you get into supplements or actual testosterone replacement itself. That's where to start.
Let's say, you've tried all that stuff and your testosterone's still like 250. What do you do?
So here, this is where we get into the very debated topic of supplements for testosterone. Personally, I'm not a fan. There are a few supplements that have been shown to have small raises in testosterone. I'm not going to mention them because I don't really support them. If you clean up your diet and lifestyle and your sleep is optimal and your testosterone is still low and you still have low testosterone symptoms, most likely the boost you're going to get from using supplements is not enough to increase it to where it needs to go. You're looking at a 10 to 20% increase if you do the right perfect stack. And usually, 20%, even a 30 or 40% increase on 250 is usually not enough to get you to where you need to be. I don't want to go too deep into it because it's just I think it's a predatory area in supplements. Everybody wants testosterone. So take this T-Max 3000 supplement to boost your libido and testosterone. And what they do is usually they fill it with things that will boost your libido, increase your sex drive, which makes you think your testosterone increased, but really it's just a libido increasing supplement. So I would stay away from those generally. You can get into them if you're someone who is like 600-700 and maybe dial in your lifestyle and you want just a little bit more, that's when I would consider supplementation. And if you want more information on that, just reach out to us and maybe we can do a mini episode on supplementation for optimization. But I don't really want to dive into it here.
Okay, so then, how do we actually treat it then? What do we do?
Yeah. So how do you treat it? Well, I'd like to start with the main line that everybody thinks of first, and then we'll go through all the different types of options, schedules, and then non-actual testosterone replacement options, if that sounds good.
Yeah, it does.
So when people think of testosterone, they think of needles, injections, and usually injections are the best way to do it. Injections to replace your testosterone, testosterone replacement therapy, as it's called, although it has been renomered to testosterone optimization therapy. If you like to optimize yourself, consists of basically going to a doctor who knows what they're doing. They'll test you for certain things to make sure that it's safe for you to go on testosterone. If it makes sense and your symptoms align and your numbers are not where they need to be, the doctor will prescribe testosterone injections. And then you do these on a regular basis. And what you have to know here is most likely when you go on testosterone injections, if you do them by themselves, this is a thing you're looking at for life. You're most likely going to be on this for life to maintain your testosterone levels, because if you take testosterone by itself, your natural production will drop, and it could come back. It's very possible, but I've seen things where it could take 2 to 5 years to come back after stopping testosterone. So it's very important to know what you're going into and either have a strategy to mitigate it, which we'll talk about a little later, or know that you're going to most likely be on this for the rest of your life. So dosing protocols, when you go into a doctor, a lot of times what they'll do is they'll prescribe a testosterone injection once every 2 weeks. And this is, that's the standard. Like a Dr. Chase face.
That's horribly confusing because the half-life of testosterone injection is like 2 to 3 days. There is one super long-lasting injection of it that does last a couple of weeks, but it's not available in America. I have friends from Australia that do it.
Yeah. So the main prescribed type of testosterone injections is testosterone cypionate. That's what we see a lot. But most doctors in this, and I got actually prescribed this way, is one massive injection once every 2 weeks. And what that does is that causes a spike of testosterone through the roof, probably north of 2,000, for a few days, and then a massive crash down. And then you ride it out the last 10 or so days, just at a low level. And then you get another huge spike 2 weeks in. So the optimal protocol, well, to be honest with you, I don't really know. I would imagine it down regulates your testosterone even more because it's getting these massive signals. I do know that a lot of people experience terrible come down mental health effects. Like on day 4 and 5, they're starting to get anxiety and depression because they were just at the super high. And now all of a sudden they're tired and depressed and anxious because of this roller coaster. So not an optimal protocol. So then you'll get into the next level where some doctors will prescribe once a week. I still don't think that's optimal. The optimal level starts at twice a week injections. That's where it begins. So you want to do smaller injections twice a week. Now, the most optimal protocol, which most people will never do because it's super annoying, is very small injections daily. This will keep the level basically stable as you go through the week. However, adherence to this and basically doing it, injecting yourself all the time, is very annoying, and people don't want to do it. So twice a week is usually where people end up.
Yep.
Is that what you see, Doctor?
I mean, that's where I try and start most people. And so the trick to doing twice a week injections is, I have people that they will go and inject their testosterone and immediately go get blood work. I'm like, that's not what we told you. You have to go get your blood work at the halfway point between your injections. So that way we can see your low point. And, if we know how low you're getting, anything higher than that's great. And so that's how we adjust your injection doses.
Yeah, that makes a lot of sense. So on the daily schedule, that's another thing. It's super easy to adjust dosages because everything's streamlined. So you can get lab work whenever. But once again, very few people will do that. I myself split the difference. So I do every other day injections. And then I inject on the off days a different prescription, which we'll talk about in a minute.
But hold on, before, we're talking about injections, but my friend Bob, he's on hormone cream, and my friend Tom, he's on pills, and my other friend Jim, he's on pellets. Why do they get to be on all that stuff and I have to inject?
So there are lots of downsides to everything else, except maybe cream, which we can talk about. The pellets, let's start with that. This is my least favorite form of testosterone supplementation because it is a little pellet you put under the skin of testosterone, little incision, put it under there, and it's my least favorite for a lot of reasons. One, you have to get cut. You have to have something under your skin sitting there. And then the dosage is very, very difficult to modify. You got to take pellets out and scoop them out from under your skin if it's too much, or you need to put more pellets in. And it's not a good idea. There are other options that are just better.
Yes and no. Sure. Once you get your dose stabilized, and just so you know, it doesn't go in the arm like you just showed. It normally goes on top of your butt cheek.
I can't show my butt cheek.
You could, but then we'd get shut down. But no, so pellets, they have a positive, and the positive is once a month you go to your doctor, they do an incision, they put the pellets in, off you go. And the one downside to them, from my opinion, is they are a slow release formulation where your dose is supposed to be steady. It is higher in the beginning and lower towards the end of the month. People definitely feel it wearing off, but it is definitely a more consistent dose. If you're someone that's like, I'm not going to do my injections twice a week, I might do them every other week if I remember, then pellets are a better option for you.
Yeah. So, and he brings up a good point. I'm talking from the perspective of a biohacker, meaning I am like rigid in all the things I do, and I am on point, and I am on my schedule, and I don't miss things, and I have it all figured out. Dr. K is coming from a perspective where he works with most of the average humans. And so adherence is actually the number one thing when it comes to testosterone replacement therapy, actually doing it. So that's probably the main benefit of a pellet, is the adherence is probably one of the easiest, because it's once a month you have to do something. So from the pellets, we have, let's do gel next. They have gel-based options. I'm not a fan of these for a few reasons. One, absorption of gel is limited as opposed to cream. Number two is it can rub off on other people or animals. So I've heard cases of people's dogs being messed up because it rubbed off on their dog.
Dogs,
Yeah.
kids.
Yeah, it can rub off and create all kinds of issues with other people. So if you have to go with a gel or a cream because you're not going to do injections or you don't like the pellet, I would recommend staying away from the gels and going for a cream base. It's a better absorption. It'll go in more quickly, and there's less of a chance of it going rubbing off on someone. But you still need to be very careful about it rubbing off. To that point, I think there is one optimal place to place testosterone cream based on the literature that seems most effective, and that is on a dry shaven scrotum. So place your testosterone cream on your balls, and that has the best absorption rating and probably least the area to affect other people. But again, this is something you need to be careful with. Don't put testosterone cream on your balls and then be intimate with your partner, because that can cause all kinds of random effects. So that's probably the optimal place to put it. A side note is it seems to be more androgenic, so you will get a higher increase of DHT and free testosterone most likely from this application because of it being put on the balls, meaning it could possibly accelerate hair loss if that's something you're worried about. Did I cover those pretty well?
Yeah. Okay, so I know the last thing is pills. Why can't I just take a pill? My favorite thing is just take a pill and move on with my day.
So you can. If you want to. I'm not comfortable with pills yet just because they came out recently. They're new. They haven't been around for years and years, and we don't have a lot of data on how effective it is, any side effects long term to my knowledge. But what's your read on it, Doctor?
Truthfully, I don't really ever prescribe the pills. I don't know how to dose them. It's just not something I ever got into. I do the cream, I do the injections, or I do alternatives, which aren't actually testosterone. So if your opinion on pills is as far as we can go with this episode.
Yeah. So, I mean, with the pills, again, I think it comes back down to compliance. If a pill is going to be the way that you're the most compliant, I would say that I would probably put it third in my list. In terms of optimal order, I would go injections, cream on your scrotum, pills, pellets. That's how I would put it. And if that's the thing you need to be compliant, then go for it. I'm still not hyped about the lack of data because I believe these hit the market a year or two ago. And so I just want to see, 5, 7, 10 years of these things and people being on them and the effects downstream before I'm really comfortable with them.
Yeah, I mean, that's a really valid is let's not experiment when we already have things that we know work.
Yeah. Yeah. So when it comes to dosage, I mean, what kind of dosage of testosterone, like milligrams per week, roughly, do you put people on? I know it's probably a huge range, but
Right. So for guys, I don't treat women's hormones. They're just unfortunately far more complicated than male hormones. Guys' hormones are super easy. You aim for the middle. For girls' hormones, it is it depends on the day, their cycle, a bunch of other factors, progesterone, and all that stuff. So I don't treat women. For men, let me talk this out. I start people on usually point 0.2 or 20 units twice a week of 200 milligrams per milliliter. That's adjusted a little bit depending on what their base testosterone is. So is that 40 twice a week?
40. Yeah, 40 milligrams twice a week. Yeah, so testosterone cypionate comes in vials that have 200 milligrams of testosterone per milliliter. That's the standard that testosterone cypionate injections come in. So 20 units is basically 1/5 of a milliliter. And so it would be about 40 milligrams twice a week. So at 80 weekly, roughly.
Yeah, that's about right. And then from there, so the way I do it is, we get base blood work, we do blood work 30 days after starting testosterone. If we're at a good range, then it's every 3 months for the first year and then twice a year after that. If it's bad, if we need to adjust, we do once a month adjustments until we get a good range, and then every 3 months and every 6 months. Because you don't want, if a doctor says, yeah, well, I'm going to start your testosterone, see you next year, don't go back. Don't start that, because testosterone needs to be adjusted and checked religiously in the beginning. You're going to run into a lot of problems. Hypogonadism is the first one.
Yeah, that's a big deal. Like, the goal is not to turn into a bodybuilder and start juicing and going way too high. Like, we don't want to do that. It increases your risk of prostate cancer, I believe. And it's just not a great strategy. We want to get to optimal. So there's a sweet spot for just about everything. We want to be, depending on your lifestyle and what feels good for you, high optimal is kind of where most people want to head. For me, I'm not high optimal because my optimal is 800 or 900 because that's where I feel the best. Because I tend to have a higher DHT and a higher free testosterone, which means my body can use it more readily. So I need a lower total testosterone.
Makes sense.
So my dosage, you step people up over time, but you start at about 80 milligrams a week. My dosage currently is right around 150 a week, 150 milligrams a week. And that varies. Some weeks it's a little higher because of my on and off day schedule. But keep in mind, folks, I'm on a fairly hefty dose, but I was at 159 total testosterone at 20 years old. So I'm coming back from a deep hole. I'm not coming back from a 300 or 400 testosterone at 40 something. So my dose would be much higher than most people would go to.
And so the point of that is talk to your doctor about your optimal injection doses.
Yeah. Okay. So, that's milligrams. Cost. Testosterone injections are not expensive. I get a 90-day supply for $36. That's with my GoodRx card. That's what it cost me. So the testosterone injections are not expensive. Where you do have to spend a little money is finding a good practitioner. So usually a onboarding consult will be anywhere from $150 to $500 to see the doctor for the first time. And then their follow-ups will be anywhere from $75 to $250 to just keep checking and make sure you're in the optimal levels. And again, like Dr. K said, once you get established on where your optimal levels are, those appointments will stretch out further and further, eventually going to twice a year and maybe once a year if everything's super stable for a long time.
Yep.
So testosterone, this is important to know. If you go on testosterone, it's going to cost you more in the first year because of working with a skilled practitioner. But by the time you get the first year done, you're most likely going to have your optimal levels figured out, and then it'll cost you much less. Testosterone injections themselves are very, very cheap. Cream is usually more expensive. I found usually you have to go to a compounding pharmacy to get the right strength, and that's it's a more expensive route.
I think pellets are the most expensive just because a doctor has to literally put them in you, so you have to pay for a procedure cost.
Yeah, that makes sense. So we talked about cost, dosage, types. Let's talk about non-testosterone replacement therapy, unless we miss anything.
I'm going to stop you right there. Let's make that into a part 2 because this episode's already getting long and not everyone's going to care so much about the second part. Some people just want testosterone. So I say that we're going to table things like DHEA, HCG, and clomiphene, and all the other variants for a part 2 coming out very shortly after this one.
Sounds good. Let's go ahead and table it. I do want to leave you with this warning, though. Do not go to your doctor and ask for testosterone if you are wanting to have a child and wanting to remain fertile. please listen to our part 2 to get educated on that. And so you can know what to go talk to your doctor about. Because if you do testosterone replacement therapy, it most likely will render you less fertile than when you started.
Yeah, unless it's properly managed. And there are ways to preserve fertility even with testosterone, but that'll be in part 2.
We'll get
Okay.
into that. I just want to give that warning here. Well, excellent. Well, thank you, Dr. K. I'm Coach Kyle. You can find me at ToxinFreeKyle on Instagram.
And I'm Dr. K, or the OsteoDoc on Instagram. Thank you, everybody, for joining us, and we'll see you next time.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.